Imagine this. You've diligently saved for years, even decades, and built up a nest egg that you plan to use for your dream retirement. But then it happens. Medical emergency wipes out your savings, and now you're reforced to take on high-interest debt just to stay afloat. It's a nightmare scenario, but it's one that's all too common. In the United States, 1 in 5 adults have medical debt collections. And those with lower incomes are disproportionately women and people of color. The numbers are staggering. Nearly 43% of adults in the U.S. have had a medical bill that they couldn't afford. In 2021 alone, medical debt collections topped $88 billion. How can you safeguard your hard-earned wealth from these potential pitfalls? Keep watching to find out. Welcome to our channel, where we help you master your money and build your wealth. Even though medical emergencies don't discriminate, not everyone is adequately prepared for the financial impact of an unexpected health crisis. This lack of preparedness often stems from underestimating the frequency and severity of such events. According to a recent study by the Healthcare Cost Institute, most Americans would need to borrow money or sell something to cover a $10,000 medical bill. That's why it's crucial to be proactive about protecting your financial future. When you think about saving for retirement, medical expenses may not be top of mind. After all, they're not like the more predictable costs of housing or food. However, research shows that healthcare costs can easily derail your financial plans. A survey conducted by Fidelity Investments revealed that Americans expect healthcare costs to account for almost a fourth of their retirement spending, which amounts to nearly $10,000 annually. But many underestimate the actual burden. Healthcare costs tend to rise faster than overall inflation, and that's not taking into account the rising cost of chronic illness treatments, long-term care, or even dental and vision expenses. For instance, premiums for employer-sponsored health insurance have been increasing at double-digit rates, often outpacing wage gains. Meanwhile, out-of-pocket costs like deductibles, co-pays, and co-insurance are also on the rise. These financial pressures silently eat away at your capital, leaving you vulnerable to unforeseen events like job loss or medical emergencies. Chronic conditions pose another challenge. They often turn into lifelong financial drains. Consider the example of diabetes. If diagnosed early, it might seem manageable. But over time, the expenses associated with medications, doctor visits, and equipment can add up, especially if complications arise. This can be financially devastating, particularly during retirement, when many people are living on fixed incomes. Similarly, the costs associated with mental health treatment continue to rise, with some therapies not even covered by insurance. This can be a major setback, especially considering that mental health issues are among the leading causes of disability worldwide. To protect yourself against these challenges, you need to be prepared. And the first step is acknowledging that healthcare costs can easily derail your financial plans. Unexpected medical bills can vaporize your savings and thrust you into high-interest debt. So it's essential to take proactive steps to safeguard your financial future. By understanding the potential risks and taking action to mitigate them, you can ensure that medical expenses don't become a barrier between you and your financial goals. The key to safeguarding your finances against high medical costs lies in building a robust health emergency fund. Ideally, this fund should be separate from your retirement accounts to avoid depleting funds meant for your golden years. Aim to accumulate 3 to 6 months' worth of living expenses in this fund. That way, if an emergency arises, you won't have to rely on high-interest debt to stay afloat. And while building this fund, don't overlook other cost-saving strategies like reducing your insurance premiums, negotiating medical bills, and investing in preventive care. Remember, every dollar saved or invested is a step towards securing your financial future. So start small, be consistent, and let compounding work its magic. With dedication and discipline, you can build a safety net that provides peace of mind and protects your financial well-being. Leveraging health savings accounts, HSAs, can significantly reduce your medical expenses and boost your savings. An HSA is a tax-exempt savings account available to anyone with a high-deductible health plan. The money in an HSA can be used to pay for a wide range of medical expenses, including doctor visits, prescriptions, and even dental and vision care. Unlike traditional savings accounts, the money in an HSA grows tax-free, allowing your savings to potentially triple over time. Additionally, any money left in an HSA isn't subject to the usual contribution limits for retirement accounts. As a result, many people use HSAs as supplementary retirement accounts. If you're eligible for an HSA, consider contributing to one. Not only will you reduce your taxable income, but you'll also have a valuable resource for covering future medical expenses. And if you're disciplined and consistent, an HSA can be a powerful tool for building your wealth. Negotiating medical bills can be daunting, but it's a skill worth mastering. The truth is, hospitals and medical providers often have financial hardships and are open to negotiation. The average hospital bill has a profit margin of 30%. This means there's room for negotiation. Many patients don't realize this and end up paying more than they should. Fortunately, there are resources like Fair Health, a nonprofit organization that helps patients understand and negotiate their medical bills. Fair Health offers tools like an online cost estimator and a patient advocate service. By utilizing these resources, you can avoid the emotional toll of arguing with medical providers while ensuring that you pay a fair price for your healthcare. So don't shy away from negotiating your medical bills. It could save you thousands of dollars. Investing in preventive care is a smart financial move. It can potentially save you a lot of money in the long run. By focusing on preventive care, you can detect and address health issues early when they're easier to treat and less expensive to manage. For instance, regular dental checkups and cleanings can prevent costly procedures like root canals or extractions down the line. Similarly, routine screenings like mammograms and colonoscopies can catch issues early, making them less complicated and expensive to treat. It's also wise to invest in your diet and exercise. A healthier lifestyle reduces the risk of chronic diseases, which can lead to substantial medical expenses. By being proactive about your health and making smart choices, you can enjoy better health outcomes while also saving money. It's a win-win situation. Life insurance can provide financial security for your loved ones if you pass away, helping them cover expenses like medical bills, funeral costs, and daily living. When choosing life insurance, consider getting quotes from multiple companies to find the best rates. You can use online tools or work with an independent broker to compare options. When applying, be honest and forthcoming with your health information. Providing incomplete or inaccurate information could lead to claim denials, especially in cases involving terminal illness. It's also essential to regularly review and adjust your life insurance coverage as your needs change over time. Life insurance is a safety net, providing peace of mind that your family will be taken care of. It's a testament to your love and responsibility towards your family, ensuring their financial well-being even in your absence. While it's impossible to completely eliminate the risk of high medical costs, it's possible to significantly reduce the likelihood of them derailing your financial future. By diversifying your savings, cutting insurance costs, negotiating medical bills, and prioritizing preventive care, you can create a buffer between you and financial disaster. Remember, it's not about eliminating all risks, but about managing them effectively. Stay vigilant, stay informed, and stay proactive about your health and finances. Your future self will thank you. Thank you for joining us today. If you found this video helpful, please give it a thumbs up and share it with your friends. Don't forget to subscribe to our channel for more informative content, and be sure to check out our other videos that we think you'll also enjoy.